couple of interesting things this week regarding the use of modalities and management of pain and that sort of thing. First one I noticed on my Instagram feed, talking about the use of ice and not worrying about expensive pieces of equipment such as game readies and things like that, and that argument that's been popular for a while now about we shouldn't use ice because it restricts inflammation and therefore slows healing, etc., etc. My thoughts on that are, to my understanding, the body can't self-regulate the amount of inflammation it needs, and therefore it treats everything as a grade 4 catastrophe and goes in all guns blazing. So the use of ice is to try and manage that. I'll come back to that in a sec. The second thing that came up in discussion with some colleagues was the use of shockwave in tendinopathy. Again, my understanding of the research is that the results are mixed and that structural changes to the tendon as a result of using the shockwave are limited. But at the Warriors, we've used shockwave to good effect at times. So why do we use both of these things, and why do they have positive effects? And I think the thing is coming back to management of pain often. When in an acute setting with an injury, often pain is what's restricting the ability of the athlete or the person to do the things that they need to get better, whether that's getting stronger, whether that's restoring range of motion or whatever. And if they're in so much pain, or at least they perceive themselves to be in so much pain that they can't load the tissue ideally or at all to rebuild the necessary tolerance to get back to doing what they need to do, well, you're not going to get anywhere. So if we come back to ice, as I said, my understanding is that the body can't determine the severity of the injury and therefore regulate how much inflammation to send to the site of injury. If we say a sprained ankle, for example, anyone that's worked with any people for a while and seen acute sprained ankles, if you don't do any sort of compression or ice or any of the RISA methods, you get this massive fat swollen ankle and it hurts. And anything else aside, I'm not in the business of trying to hurt my patients. So in my mind, anything we can do to reduce that pain is going to be beneficial. Functionally, as I said, if we can reduce that pain, the person is more likely to use the loading strategies we need to use in order to improve proprioception and encourage healing of the ligaments and return to function and return to performance. Shockwave is much the same, I've found. I don't necessarily think we're making massive changes with the structure of the tendon in those cases, in the tendinopathy example, but we've found it effective in managing the pain our players have been feeling as a result of the tendinopathy, which has then allowed us to better manage the load and improve strength and all those sort of factors, which actually do encourage the healing and the return to function and performance in that case. So I think for both those things, the key is trying to manage how the athlete is dealing with pain. And if you need to use a modality like ice or like shockwave or whatever, then I don't see a negative with that. And I think unfortunately in the case of something like icing, too many people have got on the idea of, oh, it stops healing and that's bad and everything like that. Well, I don't think it stops healing, it manages healing. And because your body can't manage the amount of healing that's going on, and it can go too far the other way which can have just as many problems as the so-called reduction of healing by cooling the tissue down and using compression. So yeah, I think key takeaway, any tool that you can use that's safe and has hopefully some backing of evidence to help modulate pain, because pain is an experience and every person's individual perception of pain is different. So any tool you can use to help you manage that and get to the important things and the most beneficial things like tissue loading and capacity is going to be an important tool in your toolkit, and you shouldn't throw it out. So until next time, go the Warriors.